each year.
Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Okay, ladies, if you feel like you are frequently running for the restroom, you are not alone. It may happen when you laugh, when you sneeze, cough, or exercise. Millions of women have urinary incontinence or leaking from the bladder, and it often comes with pelvic organ prolapse as well, but there are actually many treatments available. Dr. Meghana Gowda is a urogynecologist with Retreat Doctors Hospital, and she's here to talk about the options that people have to deal with this. So thank you so much for being with us.
Thanks for having me.
First, let's just talk about the causes, because a lot of people might think, well, I'm getting older and that's why this is happening, but that's not necessarily true.
Right, so this is actually not a normal part of aging, although it is very, very common. We see it across the age spectrum in young women, in the middle age spectrum, and also as people get older. So it's not a normal part of aging, and especially it's a shame because there's so much that we can do about it.
Okay, sometimes it comes from childbirth, but there are some other causes as well, right? Neurological causes?
Exactly, so neurologic causes, diabetes is a major risk factor. Just being pregnant, not even the mode of delivery. A lot of people think that by having a C-section it might be protective. That's not always the case.
Okay, but the good news is you don't have to just live with it. Don't just keep living with it. There are lots of treatments. Let's talk about some of the different kinds of treatments that are available.
Sure. So across the board, what I'll underscore is that the vast majority of treatments are minimally invasive. So things like physical therapy, medications. When it does come down to a procedure, we're not talking about great big surgeries here. These are small, minor tweaks that can be made.
Okay, that's really good to know. And the important thing is, again, we don't want people just living with it, but they need to be talking to their doctors about it.
That's exactly right. One of the saddest things that we see is when people start to curtail activities that they really enjoy, social activities, exercise. Those things are so important for your general health, for your mental health. So come speak with somebody, get some information, get some facts, and go from there.
Yeah, you don't want to be avoiding all the good things in life. Now, something that you mentioned before we got started today was that this can actually be a fecal problem as well, which I hadn't heard. So let's talk a little bit about that.
Yeah, so with fecal incontinence, the interesting thing is it is so much more common than we think it is. In fact, 20% of patients, so 1 in 5 women who has a urinary issue will also have fecal incontinence as well.
Wow.
And the treatments for that as well are minimally invasive, and the success rates especially are very, very high. So that's very encouraging.
Very good to know. Okay, Dr. Meghana Gowda, thanks so much for being with us.
Thank you.